the way I look at it in terms of the medication, nothing's actually changed. Um, GSK, GlaxoSmithKline, it's the company that's always made Flovent. My understanding is they're still making the medication. They've just taken the Flovent label away and are now just calling it fluticasone. Again, from what I understand, another thing you have to consider with inhalers is the actual device, whether it's the discus or the pump. Since GlaxoSmithKline is still uh, making this inhaler and the medication, really, as far as I'm concerned, the only thing changing is the word Flovent is going away.
All right. So do you have any clue why this might have caused some issues?
In terms of the insurance and things like that,
Yes.
right? So insurance companies tend to operate around January 1st. Things always change around January 1st, and then this change was also made on January 1st. Insurance companies, I don't know if it was lack of foresight, but everything is we will cover Flovent, but we're not going to cover a generic due to various contracts and things that are well beyond your local pulmonologist control and even understanding. But I suspect that GSK and insurance companies, this is Flovent and fluticasone is a mainstay treatment for asthma all across the board, children and adults. And so I suspect this is something that they will get worked out. They definitely need to get worked out relatively soon. If insurance companies don't cover inhalers are outrageously expensive. They're absolutely cost prohibitive, and now you have people with asthma who can't get the actual mainstay therapy.
Wow. In your profession, how often would you say you see patients who need to be prescribed something like now fluticasone?
Almost every single one of my patients.
Okay. And what is the general demographic of your patients?
Well, I'm an adult physician, so most of my patients start in the mid 20s, but and age goes up, and um, the number of my patients is going to be higher in the older patients. So I have a lot of 60, 70, 80-year-old patients, but they still are on an inhaled steroid, and fluticasone is one of the most common inhaled steroids.
And have you seen or heard from any of your patients trouble getting access to fluticasone?
Well, I'll be honest. As a specialist, fluticasone is as a monotherapy, as in that's the only inhaler that you're on. Is more for going to be for mild cases of asthma. I tend to see more serious cases of asthma, and fluticasone is combined with other agents in a single device, and so it's not really something that affects my patient population because we're on brand name inhalers like Trelegy or Advair that have fluticasone in them, but it's not just fluticasone, so it's not really part of this problem.
Oh, interesting. I didn't know that you could create kind of a cocktail, if you will, of asthma medication depending on the
Yep.
patient. Is that correct, would you say?
Yeah, I mean, your local doctor's not creating that, but the pharmaceutical companies certainly have created it. So you may need to be on something called an inhaled steroid like fluticasone, but also a long-acting beta agonist and a long-acting muscarinic antagonist. I know those are big words, but instead of taking three different inhalers, they combine it all into one inhaler.
I gotcha. Okay. Let's talk a little bit about this time of year. This is flu season, cold season, RSV season, all of those bad things are going around and can affect anybody, but especially for patients who suffer with asthma, I
Yeah.
imagine that those things make it a lot worse. So do you think that that has caused more concern for parents and doctors and patients in general who are struggling to find this medication?
Well, I certainly don't want anybody to overreact to anything, but absolutely, if you have asthma that is not well treated, and again, the first line therapy, the mainstay of therapy for asthma is going to be an inhaled steroid like fluticasone. If you're not taking it, then absolutely you're going to be at higher risk for complications if you get something like influenza. Now, one thing I would mention, and I've kind of already said it, fluticasone is not the only inhaled steroid. There are other inhaled steroid options. There are other options available. So if you are struggling to get fluticasone, talk to your doctor about other options of inhaled steroids. and combination inhalers that have inhaled steroids in them.
Okay, and have you noticed any sort of shortage or high demand and lower supply for these inhaled steroids around here?
Getting inhalers is always a problem, especially in patients that aren't wealthy. Inhalers are expensive. An inhaler, if you pay cash for an inhaler, costs about $600 to $700 a month to pay cash for it. So if you don't have insurance, if you don't have some sort of financial help, you almost can't get one. So this is a constant struggle of mine as a pulmonologist to be able to get my patients their inhalers. To be honest, I have not noticed anything since I haven't noticed an increase in that problem since the beginning of the year.
And this might seem like it has an obvious answer, but what are the implications for patients who need these steroids and simply cannot afford them?
Yeah, I mean, your asthma can get out of control. How out of control it gets just depends on the person. Do you happen to contract influenza virus? You know, all sorts of factors, but absolutely, if you're not taking your daily controller therapy, things can get out of control. And this isn't just asthma patients. Here in Northeast Texas, COPD is a very common disease, and inhaled steroids is one of the very common types of medications that we use to treat COPD as well.
All right. Do you have anything else that you would like to add, just in general, about this topic of Flovent to fluticasone?
No, just again, I think it'll get worked out. If people are worried about a change in the quality or the way the medication works, I would not worry about that. This is just simply removing the name. I really do think that that GSK and the insurance companies will get all this worked out. And then the last point I made, which is there are other inhaled steroids out there that work just as well as fluticasone. There are multiple types of inhalers. So ask your doctor about other options.